Okay. Yeah, first of all, thank you for joining the webinar. And today this webinar is mostly is an interactive session. It's not that I will be speaking for 1 hour, or it will be boring. So if you want to add something, if you want to stop me, you can stop anytime. You can ask me if you don't understand anything. Because a lot of people are from medical background. There are people from dietetics background. There are people from B background. So there are people from also MCOM background. So you have to be, if you don't understand, ask me. I can be slow and repeat again. And if I ask something, you also reply. Sorry, it is interactive session. Otherwise, I'll be speaking and you will be, it will be one way only and it will not be interesting. Okay. So let me introduce again. I think I have talked with everyone from Sanchita 1, Sanchita 2, Karina, Icon is Harshita, I think. Rubika, Dr. Rubika, I think I have talked with everyone. Bhavya, Kiran, it is Shraddha. My name is Dr. Jaideep Majumdar. In short, it is Dr. Joy. I'm a medical doctor. I have done my MBBS, then I did my MD. After that, I started, finding a lot of things, a lot of diseases, metabolic syndrome mostly, like PCOD, diabetes, thyroid, cardiovascular diseases, which cannot be cured only with the help of medications. There are many examples are there. For example, everybody has heard about LDL. Kiran Joshi, remind me, you are a BCom, yes, or BTech or BE? What is your
Arts,
education? Arts.
arts side. Yes,
Arts.
yes.
Okay, okay. Then LDL, you have heard about it? LDL. LDL क्या होता है जानते हैं आप? LDL. LDL, what is this? Did you heard about it? Dr. Rubika, don't get shy to answer. People are very shy nowadays to answer. Don't get shy, please. Sanchita, what is the meaning of LDL? LDL,
Low density lipoproteins.
yes, yes, yes. Very good. Don't go. What is bullet LDL? My next question. Bullet LDL क्या होता है? बताएंगे?
Bullet
You heard
LDL,
about
I'm not aware of. I've read
Okay.
about LDL and
LDL. Okay.
VLDL.
Okay.
Yeah.
Karina, did you heard about bullet LDL? Bullet LDL? You didn't hear about it? Okay. So that's why you are here. You learned around 10 new things. Because a lot of things have come up in the research works. Bullet LDLs are a new type of LDL because cholesterols are many. One is, let's say, triglycerides and LDL, VLDL. Then you have got chlorometron, micron. There are many HDL, high density lipoprotein. But there are new type of LDLs has been found, which is called bullet LDL, new type of cholesterol. It is a combination of cholesterol, it's a fat, okay, and glucose. What is glucose? Glucose is everywhere. If you eat one bowl of rice, you are getting around 100 grams of glucose you will get. Glucose is a sugar. It is not the sugar what to add in your tea. That is a different sugar. That sugar is called sucrose. There are the sugar from any grains like wheat, bread you are taking, you are getting wheat, it will enter your body and turn into glucose. So you are taking rice, it will enter your body in the intestine, it will be broken down until from the mouth, the enzyme will act and it will until ultimately in the intestine it will be glucose. Okay. So when this cholesterol combines with sugar, that is glucose, it will become a bullet LDL. Why they are dangerous? Because they can inflammate in the arteries and block the arteries. And there are a lot of medications are there. Everyone is taking medications like the largest selling medicine in the world is statins, which can reduce the cholesterol. We can make the arteries clean. Okay, and everyone has heard about statins. Um, Sanchita, did you heard about such? Sanchita from Kolkata. Did you hear about statins? Yes, or Harshada? Do you know
Sir,
what is?
actually, I unable to hear you. Please repeat
Okay,
again.
okay, no problem. Do you know what is the meaning of statins? Statins, statins.
SPA?
Statins, statins, like atorvastatin, rosuvastatin. Did you hear about it earlier?
Sir, earlier I knew the word actually. I did not know the full details
Okay,
actually.
statins are the medications which can lower down the cholesterol. Okay, but in India, everyone is taking statins. Let's say around 80% of the patient. Now, why heart attacks are happening? Let's say in 1 minute, there will be 10 heart attacks in India. I'm talking with you in 1 minute, 10 already 10 heart attacks happen. Everyone has taken the medicine. then why heart attacks are happening? The answer is statins cannot, reduce the bullet LDLs or triglycerides. It can reduce the fluffy LDLs, which are also almost harmless. Okay, so that's why it is so important that statins, the bullet LDL can be reduced only with the help of lifestyle change and diet. Remember, triglycerides also you can reduce with the help of lifestyle change and diet, because triglycerides increases. It is directly related to insulin resistance. Same thing, bullet LDL increased, when it is increased, it is related to insulin resistance. We'll learn about insulin resistance also. Everybody is aware about the insulin resistance. Dietitian Lina, I saw somewhere you were here. Yeah. Do you know what is the
Yes,
meaning of
sir.
insulin resistance? Yes. Can you tell me what is the meaning of insulin resistance?
Sir, insulin resistance is depending on the blood pressure. Actually, blood pressure actually depending on the
I'll
insulin
stop you. Stop,
resistance.
stop,
If
stop,
in
stop you. I'll stop you. Fully not correct. Fully not correct. Insulin resistance has nothing to do with blood pressure. Okay. Another Sanchita from
Can I
Noida.
tell?
You can try.
Yeah,
Yes.
yes, the body is resistant to the insulin in our body. Um,
Okay. So
like body doesn't respond, like our body, the parts,
mhm.
they don't respond to the insulin.
Which
Uh,
part of the body? Which part of the body?
um, because I've heard insulin resistance because my doctor has,
Uh,
one of the doctor has said that
what are
she is
doctors told?
insulin resistant. It's because, yeah,
Okay. First of all, you have to understand that insulin resistance is, if you are aware that insulin resistance is there, okay, it may give
yeah,
rise to in future PCOD. It may give rise to in future
PCOD,
even
yeah.
diabetes, or it can give rise to in future like thyroid. But the thing is this: in insulin resistance, insulin level goes high or go down. What do you think? In insulin resistance,
Insulin never goes higher or lower. Yes, right.
tell me
It's
the
only the
answer.
body becomes resistant.
No, no, no. The question is, in insulin resistance, insulin level go high or go down? One question, one answer. High or down? Answer me, high or down? What do you?
Um, Not
You
sure.
don't know. You're not sure.
Sorry.
So that's the
Yeah.
main thing. Yeah, because anyone, Ponu, Dilina, insulin level icon is telling goes down. Icon is who? Arshada, yes? Can you talk also? Because icon you are writing, I don't see any icon. It is better you can talk, okay? Pannu, what do you think? Insulin level goes high or go down? Somebody is telling going down. Icon or Arshada is telling going down. What do you think?
Go down. Go down.
Go
It will
down. The
go
answer
down,
is
sir.
both of you, Icon and Pannu, are not correct. Why? In insulin resistance, insulin level goes very high. Like in diabetes type 2, insulin level goes high or go down? Karina, क्या लगता है आपको? What do you think? Insulin level goes high or go down in diabetes type 2?
In type 2, I guess it goes high, and our
Type 1?
pancreas are unable to respond.
In type 1, it will go down or go high.
In type 1, I think it goes
In
down.
type 1, insulin is not produced, no, sir.
Type 1 insulin it is not there. Okay. In 1.5, Panu, what do you think? In 1.5, it's another diabetes. Type 2 is different, type 1 is different, 1.5 is different. Did you hear
Uh,
about 1.5?
no, no.
Okay, so I will explain everything. What is 1.5 and what is type 2 and type 1, and how to reverse 1.5, that also you will learn. How to reverse type 2 you will be learning. Okay, now if the insulin, who told insulin level goes high in type 2? I think Karina told. Then if the insulin level goes high in type 2, then why you are giving insulin injection? You understood my question? Very simple. Insulin level is high. Lot of insulin in the body in diabetes type 2, you told. And why you are giving insulin injection then? Insulin injection is given you don't need it. You have a lot of insulin. Do you have the answer? You don't have the answer. So, so I will tell you.
Yes,
Don't worry.
got it.
Yeah, Sanchita, do you
Yes,
have the
in type,
answer?
yes, in type 2. Yes, I got it. In type 2, the insulin level goes down. That is the reason the patient is
Opposite,
given
opposite.
insulin
Karina was
externally.
correct. Insulin level goes high
Yeah,
in type 2. Okay,
two.
but
Okay,
the body cells does not respond to insulin. But there is another
okay,
question is there, if it is going high, then why you are giving insulin injection? That I will tell you afterwards, okay, in my slides, okay. Now, so
okay, okay.
why I was asking this question, because you have to understand that not every disease like diabetes, a lot of people think I'm taking medicine, diabetes is cured. Yes or no? The answer is no. Diabetes is not cured by taking medicines like, metformin or gliclazide or glimepiride or insulin injection. Your sugar level comes down for a temporary period, and again you take medicine, again you come, it is like sugar level comes down. So people have to take the full life medication. But if you have a proper diet plan, you will be able to reverse diabetes type 2 or diabetes 1.5. All my students are able to reverse diabetes. Okay, how to reverse diabetes? If you want to reverse diabetes, you have to have a full clarity on that insulin resistance. Okay, then you will be able to reverse diabetes. So that's why knowledge is important. So not all dietitians know how to reverse diabetes, because in MSc nutrition, insulin resistance or diabetes reversal or PCOD reversal, thyroid reversal, fatty liver reversal, uric acid reversal, what is GLP-1, GLP-2, fat burning hormone, nothing is taught. The taught is the very primitive level of calorie deficit diet, which doesn't work. So that's why learning is an unending process. You have to continue learning every time. Okay. So that all these reasons that only by another example like in cholesterol, you cannot reduce all the cholesterols with only by taking medicines. You have to use a proper diet plan also. Okay. PCOD, same thing. You cannot, if you take medications which are hormonal tablets, have got many side effects. Okay, so it is better to reverse the PCOD naturally. We will see today about the PCOD reversal also. And so that's why I went to after doing the medical MD, I went to US to do my nutrition and dietetics clinical research and PhD. And after that, I came to India. Then I started to teaching also. And after I started, I got the opportunity of doing scholarship schemes on Government of India on Yale University on cancer diets. Okay, why cancer diets? Because look, cancer cells grow on glucose. Okay, and it has been found by a scientist called Warburg. He got a Nobel Prize. So we in India we are eating a lot of glucose everywhere, rice, glucose, chapati, everywhere. So cancer cells is growing on glucose, and also cancer cells grows on acidic environment, and we are eating all acidic food like milk is contains uric acid. One of the coffee is also containing a lot of acid. So cancer cell grows. So cancer cells dies in alkaline environment and this oxygen. So for the cancer diet plants nowadays, a lot of people are reversing cancer also. I have reversed many cancers. In the initial stages, we have to stop the intake of glucose. So sugar is not given to the client, and we give a different type of diet called Budwig diet, which is alternative of glucose nutrients are given. So you have heard about a lot of people are telling about that fully reversal of cancer. One of the cricket star, Mr. Sidhu, his wife got reversed. So nowadays it doesn't mean that you have to pay a lot of money for the chemotherapy, which is very expensive, around lakhs of rupees, and which will kill your own cells also. Why? But the knowledge of nutrition and diet is you can reverse cancer also. Okay. So let me just do the presentation. Look, what kind of training programs are there? There are training programs for the doctors, dietitians are there. Also, internship programs are there. If somebody wants to do internship, I have got many dietitian doctors doing internship under me. Okay, and at the same time, there are people who wants to join for the beginners from some arts background or BTech background, like Kiran, you are from arts background, I think you can start with a basic course also. Why the nutrition and dietetics has got so much high demand nowadays? Because as you know that a lot of in India we are having 80 crores of overweight people, which is increasing day by day. Almost one on the three-person is overweight, and it is giving rise to many diseases like diabetes. Diabetes, we are having 128% growth. We are a diabetes capital of in the world. We are having one of the highest. We have crossed China also in diabetes. So all these things are making people to become aware. And if you are able to 88% of people in India are having insulin resistance, means have a potential to become diabetic. So if you can have a proper diet plan, or you can have a proper lifestyle change, you can overcome so many diseases. Okay, even diabetes, thyroid, PCOD. So that's why the demand is going to very high. Demand is very high. So that's why a lot of people are being, now learning nutrition and dietetics, and enriching their knowledge, because there are training programs are there, courses are there for basic courses and advanced courses. Advanced courses is mostly those who are already, who wants to do internship, who wants to do kind of a, a PG course, or who wants to get clients. So this kind of, because advanced course you are learning about metabolic disorders like cardiovascular diseases, and how to reduce the cholesterol like diabetes, how to reverse PCOD, thyroid, fatty liver, everything you'll be learning here. And in the beginning, those who are beginners, they will be learning, like, what is some basic terms in the basic course. You'll be learning about the basics of nutrition and dietetics, like, what is meaning of glycemic index, what is the meaning of insulin index, what is insulin resistance, what kind of diet plans are there, how to create a proper diet with vitamin, minerals, protein, fatty acids. Because a lot of MSc nutritionists or BSc nutritionists have learned about calorie counting, because calorie counting is very not clear, because it doesn't gives a good results. So that's the reason why it doesn't gives a good results, because calorie can come from everywhere. It's a mathematical physics terminology. If person eating one bowl of biscuits will have 100 calorie, one bowl of fruits have 100 calories. So which calorie is good? Definitely the fruits, because it contains macronutrients also. But so let's say somebody is taking 4,000 calorie. Let's say morning time, two bowl of idli dosa, lunchtime two bowl of rice, evening time some biscuits or some snacks, night time again rice chapati, 4,000 calorie. You reduce the calorie. Let's say morning time one idli, lunchtime a little bit of rice and vegetable, night time again chapati. Okay, 1,400, 1,800 calorie, you did it. But where is vitamin? Where is mineral? Where is protein, fatty acid? Nothing, nobody is taking care of. Calorie counting doesn't make sure the proper nutrients. So that's why there is a deficiency of the nutrients, which can cause hormonal imbalance. So 90% of the diets of calorie deficit happen, the weights they bounce back. The person may lose 4 kg, and afterwards it will bounce back. So that's why calorie deficit doesn't work. There were many this clinical trials has been done in Minnesota Institute of Health Science in USA. Around 1,000 people were given calorie deficit, and everyone, bounced back their weight. Okay. Now everybody has heard about glycemic index. Yes. Harshata, Icon, do you know what is glycemic index? Icon, Bhavya, Gayatri, who knows about a glycemic index? I hope everyone should know. Jenny, are you here? Yes. Okay. Sanchita, did you Sanchita Noida, Sanchita Kolkata? Everyone has heard about glycemic index? Yes or no? Can you
Yes, yes, sir,
yeah, can
yes.
you tell what is the meaning of glycemic index? It's a very easy thing. Can you tell what is the glycemic index? Yes, I think
Sir, carbohydrate ranking. Carbohydrate ranking.
it is a little bit not clear. Okay, what is carbohydrate ranking? It is when you are eating some food. Okay, what about 5, 4, 3, 2, 1? Your name was Shraddha. Yes, Shraddha, do you know what is glycemic index? It's one of the easiest thing in the world. First thing you learned in nutrition and tactics. Can you know what is glycemic index? Glycemic index is very simple. When you eat some food like carbohydrates, how fast it will convert into glucose. Like glycemic index of
Glucose.
rice is almost 86, brown rice 76. Let's say bread is around more than something near 90. It will immediately enter your body and convert into this glucose. Okay, so that is it's a matrix. But what is the meaning of insulin index? Sanchita, now you tell me, insulin index. Glycemic index, you know. You have written me on WhatsApp.
Yeah, how fast
What is
it will increase, yeah, in the
what is
glucose. And
insulin? Now, my question is different. What is
yeah, how
insulin index?
fast? Yeah, I'm not sure about that. Maybe it's like how fast it will lower down the glucose level.
No, 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 no. It has nothing to, insulin
Insulin.
index has nothing to do with glucose. What about Shraddha
Okay.
VLCC? Do you know insulin index? You are writing me in my WhatsApp. Why you are writing in WhatsApp? Talk here. Don't write here. You are writing and writing. I have to see WhatsApp and talk with you. Don't write here. Write here. Please talk. Because I cannot concentrate on my WhatsApp while talking with you. Okay, what Shraddha is doing, writing the answer on my WhatsApp. Speak. Don't get shy to speak. What is insulin index, Shraddha? Speak, speak. Try to speak. Don't get afraid. I have to say, I have to make people become smarter. What is insulin index? Well, no, Dilna. No, you didn't never heard about it. Nobody knows what I say. Rubika, not answering. You are not sleeping, Dr. Rubika?
सर
Gayatri.
खाने के बाद जैसे कुछ भी हम खा रहे हैं तो उसको खाने के बाद हमारे बॉडी में कितना इंसुलिन इंक्रीज हो रहा है, आई थिंक ऐसा कुछ
ठीक है,
होता है
पहले
क्या?
बताइए इंसुलिन है क्या? व्हाट इज इंसुलिन? इंसुलिन का परिभाषा क्या है? बताइए
Insulin
धीरज
is
जी.
a hormone produced by the pancreas that
Okay,
controls the
then
glucose
Sanchita,
level
very
in our
good.
body.
What is the meaning of hormones? What is hormones then? Can you tell us, Sanchita? I'll be very happy. What is the meaning of hormone? Everybody
Uh,
knows. It's one of the simplest thing in the world. Everyone has
Hormones and
hormones.
enzymes are like, yeah,
Tell us, tell
uh,
us.
they are the chemicals produced by our body to regulate.
Hormones are
Exactly,
communication.
it's been 20 years.
Hormones are,
Yeah.
remember, like you say, we send, WhatsApp messages, you send email messages. Hormones are our communications. Okay, so what is the meaning of uh, these hormones? These are our the chemical communications. Okay, now what hormones are made up of?
Yeah.
They are made up of something. What they are made up of?
Proteins.
Hormones are made up of vitamins, minerals, okay, amino acids, fatty acids, zinc, selenium, some you need micronutrients like iodine. Now the thing is this, when you are doing calorie deficit diet, nobody takes care of the vitamin mineral. Who is writing here 5, 4, 3, 2, 1? Please don't write what you are doing. I have to restart again. What Sadha, don't write anything here, okay? Okay, then I have to restart. Okay. Okay, so when you're doing calorie deficit diet, nobody takes care of the vitamin, minerals, protein, fatty acids. Then what happens? The hormone imbalance happens. Okay, so that's the reason calorie deficit diet doesn't work. Okay, so hormones, how many hormones are there in our body? Any idea? Sanchita, how many hormones are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How many hormones are there? Any idea? Both Sanchita can answer. Anyone? Yeah, there are more than
Not sure.
how many? 700 hormones are there. Can you name some fat burning hormones? Fat burning hormones name?
Lipase, oh
Group?
no, it's
No,
enzyme.
no, no,
Lipase is enzyme.
no, no, no. Yes, yes.
Um,
Fat burning hormones are different. Shraddha, do you know fat burning hormones?
mm,
No one knows fat burning hormones name?
no.
Like GLP-1. Everybody's heard about GLP-1. GLP-1, GLP-2. Everyone has heard about it. Yes or no? GLP-1 is a hormone which is called glucagon-like peptide 1 hormone. Okay. Also PYY. These are all fat burning hormones. Like there are hormones like somatotropin hormone, growth hormone. Okay. But also you will learn about a new type of diet plans. Okay. A lot of people are using intermittent fasting. Now intermittent fasting means you have to have an interval. Okay. So if somebody is taking a late dinner like 10 p.m. dinner and morning time skipping the breakfast. Okay, there is interval 10 p.m. or 9 p.m.
Mm.
in the evening, morning time 9 p.m. 12 hours, and directly taking the lunch at 1 a.m. 1 p.m. Already 16 hours. Is it a good practice or bad practice? Theoretically, interval for intermittent fasting means you have to have a proper intermittent fasting means you have to have an interval. Okay, 16 hours interval is there. Is it good practice or bad practice? What do you think, Sanchita?
Uh,
I think
I think
that
it's like bad
Yeah,
practice
tell me.
because I do think it is a bad practice. I've read somewhere that there is still research going on to prove it, like if it is actually helping, because it's like 16 hours fasting is a too long period for the body to like
My question is
cope up
not
with
that.
the
My question
deficiencies.
is
Like, yeah,
skipping breakfast is good or bad? Or taking late dinner is good or
bad,
bad? Why? The
bad.
question is why? Skipping breakfast is bad. Why?
First thing in the morning, our body, especially our brain, is deficit of glucose. So we need food in the morning. So skipping like a breakfast in the morning will definitely like slow down our body metabolism, including the functionality of our brain.
So, Karina, what do you think? Having a late dinner is good or bad? Late dinner, 9 p.m. dinner. It's
No,
bad. 10
sir.
p.m. dinner. It's
it's a
good.
bad.
It's bad.
Why it
It's
is
bad.
bad?
It's bad.
Why it is bad? Because look, when you are eating anything, your insulin level will go high. Means if you eat a protein also or vitamin also, if you are eating carbs also, insulin level will go high, going high, very high in when you're taking this carbohydrate. Number two, insulin spiker is protein. Okay, number three is the fat. So whenever insulin levels go high, there will be no fat burning. Number one. Number two, fat burning generally happens from 11 to that is 1 a.m. So at the time when insulin levels are higher, in fat burning will not happen, and fat burning hormone will work only when insulin level is coming down, remember. So early dinner is better because it takes 5 hours to lower down insulin level. Now, morning breakfast is good or bad? For that, you have to understand there are some genes called clock genes. Did you hear about clock genes? Pannu or Suchitra, anyone has heard about Sanchita,
No.
sorry, clock genes? Shraddha has heard about clock genes? Or who has heard about clock genes?
No, sir.
Anyone has heard about clock genes?
No, sir.
Clock genes are genes in our body which is regulating the circadian clock. Okay, so what is the meaning of circadian clock? Circadian clock is morning time you sun rises you get up, and night time you sleep, sun sets. It is all called circadian clock or body's own clock, depending on the sunrise and sunset. It has been seen that morning time when you get up, these clock genes are activated when you have a proper breakfast. And also, these clock genes can activate our gut bacteria. Now, the question is, what is the meaning of gut bacteria? Anyone can tell what is the meaning of gut bacteria? What they are, why they are important, how many gut bacteria are there? What is the meaning of gut bacteria? Anyone knows where they are located?
They are
Gut means
located in
what?
our intestines that digest.
Correct.
Gut
Which
is
intestine?
our stomach,
Small or large intestine? Which intestine?
large intestine.
Yes, correct. Large intestine. How many
It's
gut
like
bacteria are there?
the digestive.
How many gut
That
bacteria
I'm
are
not
there?
sure.
And there are more than 100 trillion gut bacteria, more than our cells, and they are with us for
Okay.
hundreds, more around thousands and thousands of years. They are with us, and now these gut bacteria, there are why they are important. They are regulating a lot of our functions. Like if you see, there are colonies of gut bacteria there, different type of colonies. Okay, like Enterococcus, Streptococcus, they are releasing serotonin. Serotonin is important for your mood, for your well-being, positivity. For work also you need serotonin. It's a kind of a motivating factor. So you can see if the person is very low, very depressed, serotonin has some issue. Gut health is also you have to check. Lactobacillus bifidobacterium is a kind of gut bacteria which is releasing GABA, GABA aminobutyric acid. What is this? It reduces anxiety, improves calmness. The person is so impulsive, a lot of anxiety, you can understand, and with anxiety is there, it can increase cortisol, and it can hamper the weight loss, because cortisol is a fat gaining hormone. Bacillus ceretia, it is releasing dopamine. Dopamine gives its motivation and pleasure. A lot of people are becoming happy after getting dopamine. So if the gut health is problem, the person will take a lot of carbohydrate, so that you can get a dopamine from carbohydrate. Another gut bacteria called Bacillus and Escherichia coli, they are releasing noradrenaline, which is good for our blood pressure and also alertness. Lactobacillus strains are releasing acetylcholine. It's a neuromodulator which is making our memory and muscle contraction. A lot of people are having constipation. You'll find every day. One of the problem is acetylcholine. Acetylcholine enhances this bowel movement. So if is there, the gut health is there, constipation is there. So you can understand how much gut health is important. Lactobacillus reuteri, Morganella, they are releasing histamine. Histamine is for immunity. So you can understand gut bacteria is sending signal from your gut to nerve cells to your brain and releasing lot of you're regulating your mood, your learning, memory, everything is related. And also there is a gut bacteria which is called Akkermansia muciniphila. Akkermansia muciniphila. Muciniphila. It's a new type of gut bacteria which has been discovered. This gut bacteria can release GLP-1. Remember what is GLP-1? I told Sanchita, Karina, Kiran, Shraddha. You remember what is GLP-1? Yes?
It's
What is
fat burning
GLP-1?
Yes,
hormone.
fat burning
Glucagon
hormone.
like peptide 1 hormone. So it is very nowadays there is very much noise for a medicine called Ozempic, Monjaro, Wegovy. Anyone has heard about it? Sanchita, 54321, Karan Joshi.
Yes, Prof.
What is Ozempic? Karina, you heard about it? No one? Sanchita, I hope you heard about it. A lot of film stars are taking and becoming, losing 10 kilo in 1 month. A lot of rich people are taking because this medicine
No,
is costing.
I've heard of those Ojiva and things that they are taking. Does that contain this?
So this is not Oziva. Oziva is different thing. Oziva you are telling about protein shakes. This is called Ozempic. Okay,
Okay,
Ozempic or
Ozempic. Okay,
Manjaro or Wegovy, they contain GLP-1 agonist. Means it is
okay.
GLP-1 hormone, but
Fat
we
burning.
cannot produce hormone. It is similar to the molecular structure of the GLP-1 called semaglutide. That is the that we are it is created. So what happens when you are taking these injections, which are very expensive? In a month, you have to spend 5 lakhs. And what happens? The stomach will not empty very quickly. You will not get hungry, and the fat burning starts, and metabolism becomes very, it will become improve the metabolism also. Fat burning starts, but it has got many side effects. Okay, side effects like it is a semaglutide. It is not natural, so it has got many side effects like pancreatic cancer, thyroid cancer, even loss of muscle mass, anxiety, vomiting, suicidal symptom. Okay, but everybody is taking in show business there are lots of sacrifices, so that's why people are taking. And but if you are doing a proper breakfast with some food which is like rich in fibers like blueberries, or let's say strawberries or olives, or this pomegranate, these gut bacteria can produce the GLP-1. That means you can get the same effect in free. You don't have to pay lakhs of rupees for injections, which has got side effects. So you can understand, if you are able to make the gut bacteria happy by taking some food which is, and your well-being will be becoming better, because it will boost your fat burning and metabolism, and you will not get hungry. So that's why. But if you take morning time breakfast with idli, dosa, rice, chapati, poha, then it is carbohydrate. You will get hungry after some few hours. But if you take with high fibers, protein, vitamin, it will help the gut bacteria to develop much more GLP-1 hormone. So in this way, the knowledge becomes very important. You can save money also, and you can help so many people. There is another thing called SCFA. Anyone has heard about SCFA? Karina, you heard about SCFA? Shraddha, Sanchita, Kolkata, Sanchita, Noida, Bhavya, Dr. Rubika, Harshita. What is SCFA? SCFA, 3, 4 words. Harshita, you know what is SCFA? You heard about it? No one? No one has heard about it?
Fatty acids.
Yeah.
Short chain
Try.
fatty acids.
Bhavya,
I
so
Yeah,
how
short chain
how they are
fatty
formed?
acids. Yeah.
Why it is so important? How they are formed? How they are formed? Any idea?
Formed by gut bacteria.
How? Which food is important? Please tell.
Probiotic might be. I'm not sure about it, but
Okay, the food which is the SCFA are very important for us because they are short chain fatty acids and they are needed for our body to lower down the insulin level. They are formed when you're taking fibers. Fibers is what? When you're taking vegetables, fruits, then the gut produces the SCFA, which in turn can help us to lower down the insulin level and fat burning process also. So that's why gut health is very important. We will have a 4 lectures separately dedicated on gut health. If you know gut health, you will be able to create a diet plan for long term. Okay, so that also you will learn. Yeah, Shraddha, you are asking me what is GLP. GLP-1 is glucagon like peptide 1. It's a fat burning hormone. GLP-1, PYY, all these things you will learn in the internships. Okay. Now, first of all, in the basic course, you are learning basics of nutrition and dietetics plus how to create the diet plans. But in the mostly the advanced course, you are learning about the advanced clinical nutrition and dietetics, which is both for the PGs and also for the internships. You can do the advanced course because here you are not only, for example, you are learning about PCOS, PCOD. What happens in PCOS, PCOD? It is mostly when you go to a gynecologist will give you hormone and tablets. Okay, like estradiol 2 or like there. But these things are hormone and tablets are very having a side effect. It can increase the weight. It can cause nausea, vomiting. It can cause gallstone or even infertility. But all my students are able to reverse PCOD. How with the help of a hormonal balance diet. That also will learn how to do that. Also, let's say tomorrow a patient comes to you and tell, look, I have been with the dietitians for, let's say, 4 dietitians. You are my fifth one. Every time I lose weight, I gain my weight back. My age is now 35, height is 5.3, and weight is 90 kg, and I'm eating very less. I'm eating only a little bit of rice and vegetable, and I'm going to gym every day. My weight is not coming down. What diet plan you will give, dietitian Babya? What diet plan you will give? You have learned calorie deficit diet in MSc, and when you cannot make the person to starve. Yes, what diet plan you will give in this situation? And the client will tell you that, okay, look, my CRP is high, my HOMA air test is high. Nowadays, clients are very smart. They will go and do all kinds of tests, and you are in dilemma. You never heard about it. It is not taught in MSc or BSc. Anyone knows what is the meaning of a HOMA air test? Dr. Rubika, Silence, Icon, Harsada, Punnu. What is this? Homa air test. Bhavya, what is CRP? At least tell me. Shraddha, what is Shraddha 54321? Tell me what is CRP. Sanchita, what is CRP? Anyone has heard about CRP, HSCRP? No one? Bhavya?
I
Yeah,
don't
yeah,
know.
yeah. I didn't hear you are talking so fast and disappearing like a
Sir,
bullet. Tell
it's
me.
a C-reactive protein.
Yes, C-reactive protein, correct. And what does it indicate? If it is positive, it is very high. What does it indicates, Dr. Rubika? It means something called,
Yeah,
you know, you know it. Try. I know 100% you know about it.
it
It is
related
indicating
to liver.
inflammation, inflammation. Okay. When C-reactive protein, you
Yeah.
are telling about HGPT, HGOT is to liver. That is a different. AST, ALT is for liver, GGT is for liver. This is CRP is high means HSCRP is high means inflammation. So when the client is having inflammation, weight loss doesn't happen. How much you do exercise, how much you eat less food. Why? Interesting question. Arshada, tell us. Come on. Sanchita, try it. Why it happens? Pannu, Dilna, Icon. Which icon is Harshada, I think, yes? Why inflammation can stop weight loss? What is the connection of inflammation? Who wants to try? Karina, you want to try? Why the inflammation is there, the weight loss doesn't happen?
Because it's
Any idea?
accumulation.
Can you repeat?
Accumulation. It is
Accumulation.
accumulation.
Accumulation. What accumulation?
Yeah.
What accumulation, doctor?
Fluid, liquid accumulation
How
or
liquid
fat accumulation.
accumulation? Now tell me what is the meaning of inflammation first. What is the definition of inflammation? You should know it. It's very easy. You in
Yeah.
school. Tell me inflammation. Tell me inflammation
In
is this. Vabhya, you want to try? These are the simple things in the
like
life.
usually once inflammation happens, I mean usually the insulin it won't work. I mean the hormone imbalances will happen. Or
I'm asking
somebody
what
the
is the
body
meaning of
themselves will be, I
inflammation?
mean,
What is
affected.
inflammation, Vabhya? Can you tell us, dietitian Vabhya? What is the definition of inflammation? Forget about insulin. Tell inflammation. No one knows,
Like
Sanchita?
it will the blotting. I mean it will get
Bloating.
inflamed.
Bloating or clotting or what?
Blotting. I mean blotting in the sense it will be swelled. I mean
Bloating may
the
not happen in
organs.
bloating is different. Bloating means it's a gut health issue. It is not having any inflammation. Inflammation is different. Inflammation, I think everyone knows it, but when if you want to explain, you cannot explain. It is something you know you cannot explain. Yes, Dr. Rubika. Inflammation is what? It is having 5 stages, like
That's
redness
one.
can happen. A lot of people tell infection, inflammation. It may not be inflammation may happen, infection may not happen. But in infection, inflammation may happen. Swelling, heat, pain, it's called dull or color, tumor, rubor, and also loss of function means there will be some autoimmune reactions. So when a body is having inflammation, it means that some organs are in stress, like liver is accumulating a lot of fat, or this insulin is released by lot pancreas. So there are some inflammasomes are released, like interleukins and cytokinins. And what happens there? They give signal to the white blood cells, like macrophage comes and starts attacking the organs. At that time, the CRP is high. So when you are having inflammation, you have to give anti-inflammatory diet. The second thing no one answered me, what is HOMA IR test? Bhavya, did you hear about HOMA IR test? Sanchita, Rubika, what is
Test
HOMA IR test?
might be it is like how it will be. I mean, how the body resists the hormones probably. I mean, I've heard but not
Not
sure
clear,
about
not
it.
clear.
I have
Not clear,
heard,
yeah.
but
It is something not correct. HOMA IR test is the insulin resistance test. If you test, it is positive means you are not diabetic. You will become diabetic or PCOD in future. 88% of in India people are having insulin resistance. Means it gives what? Bhavya, insulin resistance. So when the person is having inflammation, you have to give an anti-inflammatory diet, or insulin resistance, you have to give an insulin resistance diet. Okay. In thyroid, Hashimoto, thyroid is a also hormonal imbalance. You have to give a hormonal imbalance diet, infertility diet when you learn irregular periods, facial hair, hormonal imbalance, everything you learn. Hashimoto disease, anyone has heard about it? Sarda, do you know Hashimoto disease? Rubika, Dr. Rubika,
Yes.
Sanchita,
One.
what is this? It is a very common.
Autoimmune disease
Yes. In It's autoimmune disease
comes
in
under
thyroid, in
thyroid.
your thyroid. So it is here, it is mostly the woman with after the pregnancy happens, because T cells will increase, estrogen increases T cells, and T cells will attack the own that is thyroid gland. And Hashimoto disease, you have to use autoimmune, that fatty liver, belly fat. Every day I'm getting so many percent of fatty liver. In India we are having 65% people are having fatty liver, 65% is. And people doesn't know also, in fatty liver it is a silent killer. When people comes, it's already late, but grade 3, grade 4, then grade cirrhosis, then you have to do a liver transplantation. So one girl came to me, her was HGPT was more than 100, fatty liver grade 3. And when I asked what you were eating, she was eating morning time idli, dosa, lunch time rice, evening time rice, so much of carbohydrate. And extra carbs converts into fat. And she was very thin. It doesn't matter. The liver was not thin, was fat, and in 3 months she cured fatty liver. There is no direct medicine for fatty liver, only by diet. Diabetes. We will learn about diabetes, how to reverse diabetes type 1, type 2, and 1.5. Uric acid diet plan, then cholesterol diet plan, acidic gastritis, acidity, chronic constipation, because the constipation is not cured. It is very common. You will not get a good results. Weight will not come down. IBS diet plan, leaky gut you will learn, because what is a gut health? There will be separate lectures in the gut health, and you have to learn about how to, this reverse IBS, irritable bowel syndrome is very common. bloating. A lot of patients are having a lot of issues with their, this burp, and also diarrhea, sometimes constipation, also like ulcerative colitis. People cannot eat properly, and also like this lupus and arthritis. All these are gut health. At the same time, vitiligo also. All this diet plan you will learn. Menopause diet plan is completely different because women at around 50 years or 52 years have a different diet plan is needed, because there is estrogen dominance, and at the same time progesterone is low, and progesterone is low, and also like testosterone is low. Also, you will learn about pregnant child nutrition, because nowadays a lot of parents are asking about the children child nutrition, because a lot of so that also you will learn. Like some children are not growing properly. Somebody is taking this bone health is not there, height is not there, somebody is not eating properly, somebody is obese, and you have to somebody has a low memory, cognitive function. All the diet plans you will learn which nutrients has to be given in the children from 8 months to 16 years. Also, a lot of people are suffering from a lot of children in 15% of the children in India have got autism. ADD means attention deficit disorder and attention deficit hyperactive disorder. These are the spectral diseases, which are also there are diet plan for it. You will also learn about it also, because children diet plans are very expensive, because not every dietitian knows about it, and it costs more than 10,000. So 10 clients you will be earning around 1 lakh. Pregnancy diet plan and breastfeeding diet plan, both you will learn, because pregnancy the diet is different, and the breastfeeding diet plan, which nutrients has to be given, it is different. All natural diet plan you will learn. Now, what is the good thing about it, that all my students, interns or PG students, they are all getting these clients after 3 months. Why clients are needed? For the practical knowledge. If you lot of people come to me, one girl, she has done, I think somebody has done in symbiosis, somebody has done in VLCC. A lot of students, they come, they don't have any practical knowledge. When I ask them how to reverse diabetes, I don't know, sir. How to reverse PCOD, I don't know. Why? Because theoretically it has been told, but practical knowledge is not there. Like all my students are able to reverse diabetes. This is one of my students, Jigyasa. You can see the client was having 152 sugar level. In 25 days, diabetes reverse. How? With the insulin resistance diet. Another example, here you can see 208. This another student is a reverse diabetes, 208, very high sugar. It came to 96, and as HbA1c was 8.9, came to 5.6. The client stopped taking, you have to stop giving medications. Another another student has reversed 197 sugar level, and it came to 87. You will also learn how to reverse diabetes, because diabetes is one of the common problem, and a lot of people think by taking medicine you are curing diabetes. Answer is no, you have to take medicine whole life, and doses will increase. If you take a proper diet, your medicine dose will come down. In many cases, you don't have to take any medicine. All these clients stop taking medicine. Otherwise, you have to take insulin. Insulin will destroy your kidney, and you have to go for a dialysis. That's why the dietetics and nutrition have high demand. And diabetes diet plan is also around 10-15,000. So 10 clients, you are earning 1.5 lakh. Sarika, this is one of my clients. She was having sugar level of 400, very high sugar. It came down to 100 in around 4 months, and also she was taking insulin injection. When she came to me, she was in a very bad shape. As you can see her this there was pigmentation, a lot of fatty liver, high cholesterol. She was feeling very bad, because she was taking also insulin injection 25 units, diabetes type 2. And after doing the diet, after 2 months, the doses came down to 6 units, and after 4 months, no insulin. Insulin was stopped, and she lost around 18 kgs, and diabetes reversed, fatty liver gone. Same person you can see here, before and after, 40 years looking like 30 years, looking younger, and 87.5 to 69, and fully diabetes reversed with the help of a diabetes reversal, insulin resistance diet plan. You will also learn about it. Okay. Now, I'm not, a lot of people are taking medicines, fine, but if you take medicines also, but you don't have a diet plan, the medicine dose will increase, like 500 metformin you are taking, and thinking I am cured diabetes, I am taking whatever I like. After some time, the doses will become around 1,000 metformin. Metformin is a medicine, those who doesn't know, okay, which is given for the diabetes. It will increase to 2,000, then it will not work. Then you have to give some glitazones or insulin analogs or insulin injection. Ultimately, what is happening? This is the complications. Even though if you take medicine, okay, you will be taking as per as the WHO background, WHO guideline, you will be having kidney failure or blindness or heart attack or stroke or limb amputation. I'm not telling to stop taking medicine, but if you are able to create a proper diet and follow it, your medicine dose will not increase, and many cases fully reverse diabetes. Now, why all these things happens? Kidney failure. Most of the diabetic people are having kidney failure, even though you are taking medicine, or heart attack. Why? Because the thing is about the HbA1c. I hope everybody knows HbA1c. Yes, correct. What is the meaning of HbA1c? Dr. Rubika, Bhavya, everyone knows HbA1c. It's an easy question. Hmm? What is HbA1c? Everyone knows?
How much glucose is there in the blood might be according to
Yeah.
the picture.
Yeah, but it is what? It is a combination. It's called AG, advanced glycation end product. Means combination of glucose with hemoglobin. Combination of sugar with protein. Hemoglobin is a protein. So whenever it is combined sugar with protein, it becomes advanced glycation end product. So it is happening when you are taking lot of glucose in your lot of sugary foods. Definitely this sugar will combine with protein, and it becomes HbA1c is a very sticky substance. It will start creating scratches in your arteries, like you take a knife and scratch in your frying pan. Okay, it will damage the endothelial layer of the artery. Now, what happens? HbA1c is more than 6, it is dangerous. There is 6% of the this hemoglobin is having sugar is dangerous. 6.5 is already diabetes. So, what does the HbA1c do? You can scratch the artery. Say here, this is the endothelial layer of the artery. HbA1c destroys it. And what happened? Bullet LDL can get through. What is the meaning of bullet LDL? As I discussed, combination of it is oxidized LDL, means when glucose combines with cholesterol combines with glucose, it becomes smaller in size, and they are very dangerous, like bullet. They can get inside, and they cannot be reduced by any medications, like a fluffy LDL or normal LDL. They are harmless. Most deadliest is the bullet LDL. What does the bullet LDL do? When the artery is scratched, it can get inside here, like here you can see the endothelial layer is crashed, bullet needle gets inside, and what happens? Our body immune system starts reacting. Macrophage comes and starts having a reaction called inflammation or foaming reaction. This is how it is formed. This is how it is formed. Look, normal artery, it has been reduced, narrowed, and what happens? If it is in a major artery in heart, it can do heart attack. So that's why 80% of the diabetic people are having risks of heart attacks. Clear now? Then HbA1c can, if it is lowered with the help of a diet, all this inflammation of the arteries will not happen. Blockage of the artery will not happen. Okay, and it will reduce the heart attack. And also, HbA1c can also destroy it can destroy the this kidney also. It can cause nephropathy, because when the sugar is more, sugar can hold more water due to the osmotic diuresis, and what happens, you will lose lot of water also, so that's why the kidney functions is also disrupted. Neuropathy can happen, and also retinopathy. All these are complications of this diabetes. And afterwards, what is going to happen? You can see here, this is high BP, then whole body is affected, then slowly heart attack, limb amputation, because sugar environment can let grow the fungal so much that no antibiotic is going to work. Ultimately, limb amputation. So another thing that's why what I'm telling that why I'm telling this. If all these situations, if you take medicine, also this kind of situation may happen. But if you are taking a proper diet plan and medicine, your medicine dose will come down, and in many cases you will not have all these complications. Because if the nephropathy happens, then the patient has to do dialysis, and dialysis is not easy. It is done around before dialysis. You have to do some operation preparation called fistula has to be added in the patient, and then only you can have the dialysis, and it is costing around 10,000 rupees per day. You have to do 15 dialysis in a month. After that, kidney transplantation, it is also costing around 5 lakhs, 50 lakhs. So that's why you can understand the complications for diabetes are very high, and if you have a proper diet plan, all this situation will not happen. Okay, so now how triglycerides are formed? A lot of people will tell that it is formed from where? Eating fatty food. The answer is Not so correct. Nobody eats so much of fat. Okay. So how triglycerides are formed? Anyone knows? No one knows. Sunchita, do you know how triglycerides are formed? Why it is so important? Triglycerides. Who knows triglycerides? How they are formed? Karina, Rubika, Shraddha, then Harshida, Icon, Gayatri, Pannu, Karina, Sanchita. No one knows. It all starts with it's all start with the high carbohydrate. When you take a lot of carbohydrate, it will increase the insulin level and it will increase the adipokines and hormone sensitive lipase. These are the kind of enzymes which can release more triglycerides, more and more fatty acids from the adipocytes in the in our blood. Then what happens? There is a this protein called CETP. CETP is what? Cholesterol ester transfer protein. It will grab these fatty acids and take to the liver, and liver will turn into what? Triglycerides. And of course, fatty liver. So fatty liver is coming from high carbohydrate and high insulin. So that's why insulin resistance is very important to learn. Understood, Sanchita? You told about insulin resistance earlier. Yes. Now, what is diabetes 1.5? Anyone knows about diabetes 1.5? Bhavya, Karina, anyone knows about diabetes 1.5? No one?
No, sir.
Diabetes 1.5 is also called LADA. What is the meaning of LADA? Latent autoimmune diabetes. If the diabetes is happening, after 40 years and there is no obesity, then there is a chance that it is a LADA, okay, which is also called latent autoimmune diabetes. Means there is a autoimmune disease is there in our body in family history like IBS or Hashimoto, and when it is high, there are diagnosis C-peptide protein is high. What is C-peptide? Is a precursor of insulin. Means when insulin is released, C-peptide releases insulin. And in diabetes 1.5, the C-peptide is low. Okay, in diabetes type 2, it is high. That is one of the diagnosis. And also there is another thing, GABA, that is GAD, that is glutamic acidic decarboxylase, is also positive. Then it is diabetes 1.5. And what diet plan you have to use? Anti-inflammatory diet. Okay. Now let us discuss about the insulin resistance. Okay, today we have, in the beginning, we have discussed about insulin resistance. What is the meaning of insulin resistance? How it happens? So to understand the insulin resistance, because if you know insulin resistance, you'll be able to reverse diabetes, PCOD, and also thyroid. So that is the reason it is very important. So how it happens? Let us see how much carbohydrate we are taking in a day. Okay, morning time, let's say in North India, it will be paratha. In South India, it will be idli dosa. In Mumbai, it will be like poha or this bread or pav bhaji. So morning time, 100 gram easily it's going in your body. Okay, lunch time, again rice or upma or bread or chapati, again 100 gram. Evening time, again some snack, 50 gram. Night time, again 100 gram rice, chapati, upma, idli. So in a day, around how much? 300 grams, 350 grams of glucose going to your body, and body will take around 20%. Okay. And the rest, 80% is going to liver and turn into fat. Okay. Why? Because whenever you are taking food like rice, chapati, idli, dosa, it will enter your body and turn into what? Glucose. Okay. And the glucose, what does it do? It will be circulating in your body. And what happens? Insulin comes. Insulin comes and it will grab the glucose from the blood. Okay. Insulin comes and grabs the glucose from the blood, and where it will go? It will go to your, the glucose is distributed in your body. How much the body can take? The body can take maximum 20%. That's 100 grams of carbs you're taking from one bowl of rice. You're able to 20% will be absorbed in your body. Okay, and where does the other percentage of glucose will go? It will go to your which organ? Which organ? Anyone? Which is the chemical factory,
Liver.
Sanchita? Liver, 100%. Very good.
Liver.
Liver and turn into fat.
Yes.
So you can understand how
Yeah,
much
it turns to fat.
people are becoming, why people are becoming overweight. In the morning time, imagine the person have taken one bowl of idli or one bowl of paratha, chapati, already 100 gram, 20 gram absorbed, 80 gram converts into fat. Lunchtime again, rice, chapati, 50, 60 gram converts into fat. Evening time again, chapati. In a day, 100, 150 grams of carbohydrate is converted. Multiply by 10, how much? Multiply by 30, how much? Already 2 kg, 3 kg. I have seen one of my client increase 6 kg in a month. It is possible. This is how people increase the weight. And in 10 months, 20 kg. In 2 years, 30, 40 kg. Like a woman comes to me and tell, sir, 2 years I am not able to lose weight. My weight has become 110 kg. My height is 5.3. And when I ask what is eating, morning time poha, idli, dosa, lunch time rice, 2 bowl of rice, evening time again rice, night time chapati, upma, so much carbs you are taking, and every day you are increasing 100 gram, 120 gram in a month, 3 kg, 2 kg. You are not able to distinguish. No, it is not noticeable. But after 10 months, it is noticeable 10 to 15 kg, 20 kg. Okay. Now, what is the solution? You cannot tell the client, okay, stop taking chapati, idli, dosa. Client will tell you how I will survive. I like it. I like the food so much. I cannot live without it. So ideally, it is not that you have to stop eating rice chapati. You can eat, but eat in an intelligent way. There are certain hormones that are in our body called fat burning hormones, like GLP-1. I told you, GLP-2, the somatotropin hormone, AMP kinase. These hormones has to be activated. So that means if a person is taking 3 idli and he's becoming happy, the stomach is full, you have to reduce the carbohydrate to 10, 1 idli or one chapati. You have to add proteins, vitamins, minerals in your diet. So it becomes a balanced diet. So hormones are activated. Okay. And what you are doing lunchtime also, you have to add some protein, vitamin, minerals. Automatically, if you are taking 90% carbohydrate, you will come down to 20, 30%. And hormones means your fatty acids, vitamin, minerals, protein are there in the diet, hormones are activated. Secondly, your insulin levels are higher. Morning time, chapati, rice, idli, dosa, insulin levels are higher, high carbohydrate. Lunch time again rice, evening time snack, night time chapati. When insulin levels are higher, fat burning will never happen. Remember. So you have to lower down the insulin level. How? With a proper combination of a diet plan. You will find a lot of people telling, I'm going to gym every day, I'm eating proper diet, I have a dietitian. No weight loss. Weight is stuck. Weight comes down and go up. Go down, come down and go up. Insulin resistance. The dietitian has no idea about insulin resistance, or a gym trainer has no idea. Okay. Now, in the gym, do you burn fat? Yes or no? Sanchita, what do you think? Karina, in the gym, do we burn fat? Yes or no? Interesting question.
Yes.
The answer is no. You never burn fat in the
Okay.
gym. Sanchita, you are burning glycogen. What is glycogen? Stored carbohydrate.
Glu
That is from
glucose
40
turn, yeah.
minutes. 40
Storage form
minutes.
of glucose.
Storage, 40 minutes you are
Stored
burning
from
your
in the liver.
glycogen. Then after glycogen finished, you are
Glycogen.
burning muscles glucose. And fat burning needs 5 hours. Nobody is going to have 5 hours. But when the fat burning happens? In the resting phase. That's why sleep is so important, 11 to 1 a.m. A lot of people will take, I'm going to gym, I'm going, having exercise. No result, zero result. Ask the one question, what time you sleep? Okay, sir, 2 a.m. Because I work. Zero results, because sleep has to be 8 or 9 hours, minimum 8 hours, because when you sleep, the body recovers and fat burning hormones are active. Mostly from 11 to 1. So you have to sleep early a little bit. If you sleep 2 a.m., 1 a.m., nothing is going to happen. Understood? And when you are sleeping, your immunoglobulin A is working. Means it's sleeping is also a diet. Your body will recover and fight your bacteria, everything. Okay, remember sleep is so important. And it will lower down the cortisol level. If you don't sleep, cortisol level will go high. Cortisol is also like sugar only, because it will increase the weight. Clear now? Now, the insulin levels has to be lower down when you are creating a proper diet plan. That also we will learn how to lower down the insulin level with healthy fats, vitamin, minerals combination, micronutrients, potassium, magnesium, selenium. You have to add fibers. Then insulin level comes down. When insulin level comes down, the fat burning will happen, because insulin is a dominating hormone, like a principal coming to a class, or children are shutting their mouth. So when insulin is going away, it will come down. Then fat burning will happen. And how to make it come down? First of all, you have to add some macronutrients with a combination of the diet. Definitely, it will be less carbs, protein will be more, vitamin, minerals, fatty acids, so that insulin level comes down and fat burning will happen. You can see all my students are able to create diet plan, 24 kg loss in 90 days. around 1 kg lost in 13 days, 13 kg lost in 2 months, you can see the results. 700 gram loss in a day. It is nothing magic because insulin resistance has been overcome, means insulin level is coming down, fat burning hormones are activated. Remember, okay? And you can see the results before and after, before and after. Here, same woman, 18 kg lost, 40 years old, looking like 30 years old. When you lose weight, you look younger. Why? Because there are some anti-aging factors that are activated when you lose your weight. Understood? Yes. So you will also learn how to create a diet plan when a patient is coming to you that I am fed up with, I have went so many dietitians, no results, and at last I'm coming to you for help. You can help it because you know insulin resistance, and dietitians have given a diet plan, calorie deficit diet plan, and you can become a superior dietitian, and one client will give you 10 more clients. The most toughest clients you can help. Okay. So let's come to the insulin resistance. Okay. So you can understand if you are taking around 300 grams or 400 grams of glucose, our body will take around 60 grams, 20% rest is going to liver and turn into fat. That is a reason. Non-alcoholic fatty liver, NAFLD or NAS is non-alcoholic ceatic hepatitis, which is inflammation. Okay. And if you don't treat, if you don't reverse, only reverse it is naturally. You will get what? Fatty liver will turn to liver, cirrhosis and liver cancer also. So you can see this is an example. The fatty liver of a girl, 100 to 112 is the GPT GOT, and after 3 months it came down to 32, 27. Fatty liver fully reversed. Only with a diet plan. There is no direct medicine. And also belly fat, all these things can give rise to visceral fat and also metabolic syndrome like diabetes, hypertension, cardiovascular disease, PCOD, non-alcoholic fatty liver, and cancer. Why cancer? As I told you, cancer cells grow on glucose. This is called Warburg effect. And cancer cell doesn't require any oxygen. They grow. They don't have any mitochondria. They directly grow. And to stop the cancer cells to grow, you have to stop the glucose. That is the supply chain of glucose has to be stopped. No, we will not discuss so much about cancer today. Let us focus on the diabetes also, because why diabetes happens? Because look, what did you have to understand insulin resistance? When insulin level goes high, remember, whenever you are taking a lot of carbohydrate, rice, chapati, upma, idli, those are for many, many years, insulin level goes at 5, 7 times because more carbs, more insulin is produced. And ultimately, you can see number one insulin spiker is carbs, then protein also can increase insulin level, and number three is fat. Now, what happens? Our body is made up of cells. Everybody knows, yes, trillions of cells, and in outside the cell there are a small receptor called insulin receptor. Insulin acts like a key. It comes and attaches to it and opens it, and the door opens, means the cell door called glucose channel opens and sugar goes inside, vitamin goes inside the body cells. Like you are going to your home, you are opening the lock with a key, and the door opens, you get inside. But imagine you have got 5 keys or 10 keys. You insert the 10 keys inside the lock will open. Yes or no, Dr. Rubika? The answer is no. You need only one key for one lock. Yes, Karina? Sanchita, understood? Same
Yes, sir.
thing happens when you are
Yes.
having lots of insulin. Why lots of insulin? Rice, chapati, idli, dosa, upma, poha, eating and eating. For many, many years, insulin is more. The receptor doesn't respond. And what happens? Doors are closed. Like more 5 keys, 6 keys, 10 keys, the receptor will not respond. You require only one key, less insulin, more insulin. And the cells are hungry. Sugar is outside because the doors are closed. It is outside the blood. That is called insulin resistance. It is not diabetic yet. Outside sugar is there and it is going to where? It is going to your liver and turn into fat. So fatty liver or weight gain, inflammation can happen because more and more insulin is produced by the pancreas. Okay. Now, what happens? Also hunger, because a lot of people will tell you, I eat food and get hungry. I need more sugar or more, something sweet, because the cells are hungry. Nothing is going inside. It is blocked. Also fatigueness, no energy. These are all symptoms of insulin resistance. It can give rise to diabetes, fatty liver, cardiovascular diseases, because high level of insulin, cell doesn't respond to, this receptor doesn't respond to glucose. Insulin and sugar is outside. What are the symptoms? There are like you will get fatigueness, means energy is not there because body is not getting nutrients. There are a lot of people will tell, I work but I have no energy. I cannot go to gym. I cannot run. Or the hunger after I eat food, or I get hungry very much. I have to eat some sweet sugar. sugary food or carbohydrate. These are called insulin resistance. And afterwards, it will give rise to our diabetes. High level of insulin, receptor doesn't respond, sugar is outside. And diabetes happens. How to reverse diabetes then? You have to lower down the insulin level. So that's what you learn. Lower down the insulin level, how with the help of micronutrients, macronutrients in a proper diet plan, and receptor will respond. Okay, now why my question was, I think to Sanchita, I think, yes, if or Karina, if the in diabetes type 2 insulin levels are higher, then why you take insulin injection? Why? Because look, when the body cells are hungry because they are not getting nutrients, they give instantly signal to the pancreas to make more and more insulin, and pancreas starts making more insulin because the cells are hungry and they are giving signals. And sugar is more in the blood and it goes to the pancreas, and more insulin is produced, and pancreas starts overwork. It starts burning out. Then what happens? There are some it is in stress, so it will give a signal like inflammasomes are released, like cytokines, interleukins, they go to the white macrophage, and macrophage comes and start destroying the pancreatic cells. At that time, you need insulin injection. But if you create an anti-inflammatory diet, means you have to reduce this macrophage, you can save the pancreas, and you can create an insulin resistance that when lowering the insulin level, you can reverse the diabetes. Okay, so that also you will learn. We'll have around 5 lectures about diabetes. So you will learn how to reverse diabetes completely. Okay. Now, who is joining Krishna Tamboli? So late. Okay. I think Bhavya, you left. You have got some issues. Now you joined again. Yes. So you will learn also about the diabetes reversal. Definitely, after the lecture, each module you will get some clients so that you are able to practice. Okay. Practical knowledge will be there. Krishna Tamboli, you are a great person. What I will tell you, you joined after 1 hour. Why so punctual? Krishna, why so punctual?
Sorry, sir.
Okay, very good. So it is good that you have joined. You are
Actually, I
M.Com.
will.
Okay. So I'll
I'll be
send the
missing
recording.
now.
Yeah. I will send you the recording, the part you missed. Okay. Okay. And
Thank you,
also,
sir.
okay. So I think you are M.Com graduate. Okay. Record needs to be sent. Okay. So we are in the halfway. So we are finishing the webinar after some time. We were telling about
Thank you, sir.
the diabetes reversal. Okay, how to reverse diabetes, how to reverse PCOD, and what I was telling that when you are in diabetes, what happens? The insulin doesn't respond to this receptor doesn't respond to insulin, and sugar level is higher. So if you want to reverse diabetes, you have to lower down the insulin level. What is insulin? Insulin is what, Krishna? No idea.
It's
You
a
just
like hormone.
you just jumped in the sea and you are confused what is going on. Insulin is like a hormone which is taking the glucose from the
Okay.
blood to the cells. But when insulin is more, this receptor does not respond. Like, insulin acts like a key. Insulin is less, the receptor will respond. Insulin is more, like you are having
Okay.
5 keys. You can inside the key, it will not work. Same thing happens when you have a lot of keys. You insert a lock, it will not going to work. Same thing happens when insulin increases. When you take a lot of carbohydrate, the receptor doesn't work, sugar is outside. This is diabetes. Okay. If you didn't
Okay.
understand, you talk with me after this lecture, I will explain. Okay, don't worry. And how to overcome diabetes, you have to lower down the insulin level with a proper diet plan. Okay, so in this way, you will learn how to reverse diabetes. We'll have 5 separate lectures on diabetes also. Okay, when the insulin levels are higher, it is called insulin resistance. When insulin levels are higher, what happens? The body will not get vitamins, minerals, protein, fatty acids, everything is blocked. Why it is blocked? Because the receptors will not respond to insulin. Then what happens? A lot of people will see that they are getting, potassium is low, constipation. The constipation, regulates the bowel movement, or somebody will have, fatigueness or hair loss, muscle mass loss. All these things can happen. Hormonal imbalance can happen. Okay, so all this situation is called insulin resistance, and it can be overcome with a diet plan. So whenever you see a patient is telling, I am not able to lose weight, or I am having, hunger, inability to, I went to many dietitians, there is no results coming. Then you will see that there is a high chance of insulin resistance is there. Okay, so insulin resistance can give rise to hormonal imbalance, because hormones are made up of vitamins, minerals, protein, fatty acid, and body is not getting nutrients. Then hormonal imbalance can happen, or it can happen to other issues like, PCOD. All these things can give rise to insulin resistance. Okay, now what is this? Another thing we will learn about also uric acid, because everybody knows that uric acid can go high when there is a when people are taking a lot of meat and proteins like this, but it doesn't every time, because sometimes when people are taking a lot of carbohydrate, uric acid can go high. Why? Because there is a thing called ATP. Everybody knows about ATP. What is the meaning of ATP, Karina, Sanchita? What is the meaning of ATP? Anybody remembers? ATP is what, Sanchita?
No idea.
ATP,
Adenosine
adenosine
triphosphate.
triphosphate.
It's a kind of
Right.
a,
Okay.
yeah, it's a kind of a energy currency. So when you are taking a lot of carbohydrate, it converts into ATP, then ADP, adenosine diphosphate, then uric acid. So when you take a lot of carbohydrates, you can convert into uric acid. Remember, and uric acid can block enos. Enos is what? Endothelial nitric oxide synthase. It's a dilating. It is the dilation of the arterial. So when it is blocked, it can narrow the artery and increase the BP. Also, high uric acid can cause gouts and uric acid crystal, which are very painful. So you will learn about uric acid diet plan also. Okay. Now, why PCOD happens? Karishma, do you know why PCOD happens? Sorry, not Karishma, Krishna. Why PCOD? What is the main cause of PCOD? PCOD is polycystic ovary disease, which is very common in India. One of the three women will have. Karina, do you know why PCOD happens? Sanchita? Everybody will
Because
tell
of
me about hormonal imbalance. Yes?
Yes.
But why it
yes,
happens,
sir.
doctor? Because look, our woman's body is having what? This our woman's body is having ovaries. Okay, and ovaries are containing releasing estrogen. Okay, but there are some cells in ovaries called Teca cells. They are releasing androgen. Androgen is a male hormone, which is very little in women, more in the male. But what happens when the insulin level increases? Why insulin level increases? Everybody knows. Yes, rice, chapati, idli, dosa, more carbs, more carbs. Definitely insulin level will increase. When insulin increases for many years, androgen increases. So what happens? There is a hormonal imbalance in the woman. Means high insulin, high androgen, and it can cause initially hair loss, hair thinning, acne, facial hair, all symptoms of hormonal imbalance. You will see a lot of women will have these issues, and slowly, it can, create what? Cyst formation, facial hair cyst, and the periods starts, fluctuating, flow is low, hair loss, acne, weight gain, hair loss, all these things, mood swings. PCOS can convert into polycystic ovary symptoms, can convert into PCOD, polycystic ovary disease, where the cyst formation starts, and cyst can release more testosterone and it can make the follicles immature, means infertility. And afterwards, cyst may rupture and cause bleeding and you have to do operation. What gynecologists give? Hormonal tablets. So hormonal tablet doesn't work, because if you take hormonal tablets, you cannot take more than 3 months and it can cause nausea, vomiting, gallstones, and also it can cause infertility. And many hormonal tablets can cause fibroid also. Okay, now what is the solution? Solution is this, that you have to, you can see that all my students are able to reverse PCOD naturally. This is 6 centimeters cyst disappeared. Another around 7.9 centimeters cyst reduced. How? Because you have to create, you will learn how to create a diet plan to lower down the insulin level. When insulin level is high, then androgen is high. But if you lower down the insulin level with a proper diet plan, like here you can see, insulin level is coming down, the androgen level comes down, and slowly your cysts will disappear. So PCOD can be reversed within 3-4 months. You will also learn about it. But if you don't reverse PCOD, it can give rise to what? Endometriosis, which is called bleeding, and also fibroid. Then you have to do operation. There are, fibroid, it can be small, it can be large. But there are diet plans for fibroid also to stop it, but it is not the thing we want to have it. And also there are lots of PCODs nowadays which are called lean PCOS. What is the meaning of lean PCOS? Lean PCOS is even thin girls can have PCOS. Okay, like a lot of people are having this one. A lot of people are having, a lot of girls come to me and tell, I'm very thin. How I can have PCOS? It can happen because due to the insulin resistance, infertility can happen, dark spots below the eyes, all these things, and very small chocolate cysts, and they're underweight, and it is accompanied with anxiety, stress, and also infertility, And definitely, ideally, the CRP is high, so and inflammation is there. So we give a anti-inflammatory diet. You will also learn about it. Also, thyroid issues. Nowadays, you will be getting a lot of questions with thyroid. In thyroid, what happens? Thyroid is a gland which is producing T2, that is T4, and T3 is the active form which is produced in mostly in liver and kidney. But the thing is this: when T4 is less, it's called hypothyroidism, and THS level goes high because when T4 is less, it gives a signal to the hypothalamus, and it is releasing hypothalamus releases TRH, the thyroid hormone releasing hormone. It gives a signal to pituitary gland, the master gland, to release TSH. When TSH is high, is an indicator. Okay, now when what is the mostly doctors are giving? Doctors are giving hormonal tablets called Tylenol, thyroxine, artificially synthesized thyroxine. But if you take Tylenol, thyroxine, you have to take whole life, and it is not a cure of thyroid. It is like it is like a temporary management. Like somebody has broken a leg, you give a stick until the leg is cured. You have to take the stick. So that's why it doesn't work, and other symptoms are prevailing. Even though if you take Tylenol, weight gain will happen. Some mood swing will happen, fatigueness, low energy, and also like hair loss, infertility, miscarriages, which are very common. But thyroid can be fully reversed. How? Because what hormones are made up of? Vitamins, minerals, proteins, fatty acid, amino acids, zinc, iodine. Especially iodine is important here, and also like selenium. If you give all macronutrients, the hormone will start working. The thyroid gland will create hormones. In this way, we will able to reverse hormones, and of course lowering down the insulin level. You can see here a lot of people doesn't know. People keep on taking medicine. The doses increases. Tylenol increases from 25 to 50 to 75 to 100 mcg to 150 to 200, 300. This woman, Mrs. Sangvi, is my client. She was taking 23. She was taking 250 mcg of Tylenol. 23.59 was the THS. But after taking the diet, it came down and she reversed thyroid. Another example, this woman was having, Mrs. Kanchan, 94 kg, 14 kg lost, and also her THS level was 39.7, very high. She was taking around 300 mcg of Tylenol. After 4 months, fully reversed thyroid. Another example, thyroid 4.15, she was taking 50 mcg. Her name is a client, her name is Mamta, and she reversed thyroid within a month. She stopped taking medicines. Your thyroid is affecting the whole body. Medicine alone is not going to work. But right now it can cause pain, this constipation, pancreas. It can cause liver, diabetes, fatty liver. Because all these things are, it's called Harroward chart. So you have to understand thyroid can be fully reversed, and also Hashimoto disease can be reversed. Okay. So definitely you will learn about thyroid. We'll have a separate lecture about diabetes, about PCOD. Now one interesting question: what is good for us? Egg yolk or egg white? What do you think, Krishna? What do you think, Karina? What do you think, Rubika? Egg yolk or egg white? What is good for us? Sanchita, what do you think? Egg white is the best or egg
White
yolk?
especially, yeah.
Both.
Sanchita, you
Both
are
are
telling.
good because egg yolk has also got vitamin A, iron,
But
and
egg
many
yolk
other
is
nutrients.
fat.
But egg yolk,
Egg yolk is fat. You forgot about the
protein,
fat. Yes, you
yeah,
forgot.
fat. Yeah,
See,
in the
uh,
yolk,
egg
yolk has
yolk
got
is full of
fat.
fat. Yeah, but the thing is this.
Yes,
Another
and
thing you forgot. I am reminding you. Which which if egg yolk is which fat? It's a good fat. Remember. Okay, so your first answer was correct. Okay, that egg yolk is equally important because it's a healthy fat. It's a omega 3. It is not a
yeah,
bad fat. Understood? So don't get confused. Egg yolk is one of the best food. Why? Because it contains choline, which is antidote to cholesterol. Okay, so a lot of people think egg yolk is bad. It's a very old theory. In 1930, there was a clinical trial 100 years back that egg yolk is containing fat. At that time, there was no understanding of egg yolk and egg, HDL and LDL. Now we know LDL. What is HDL? High density lipoprotein, which is good for us. And also, egg yolk contains what? Iodine, selenium, zinc, copper, iron, magnesium, calcium, all macronutrients for your health, for your hormonal balance, and also choline, which is good for fatty liver. And also it can reduce the cholesterol. So it is opposite. Egg yolk is very good for us, and it contains vitamin A, vitamin D, vitamin E, vitamin K, which are all fat soluble vitamin. Okay, and also it contains high quality amino acids. But egg white is also good. Okay, but if you take only egg white, it's not good because it has got high insulin index, because number one insulin spiker is what? Carbohydrate, then protein, then fat. So if you see the egg yolk, egg white has got 55 insulin index. It can raise the insulin level very high. A lot of gym trainers are giving 5 egg whites in the night. What will happen to the patient, client? And egg yolk has got low insulin index, 15, because it's a fat. So if you take together, the insulin index comes down to 21. Why insulin index is important? Because we know that insulin spike can stop the fat burning. So the food with low insulin index is good for us. Clear now? Icon, Bhavya, 5431, Shraddha, everyone has understood what is insulin index. Yes? So that's why
Understood.
knowledge of good, and good knowledge will give you good health and good future for your patients. And what about snacking is good or not? Another general knowledge question. Krishna, snacking is good. Morning time you eat breakfast, then again snack, very tasty snack. What do you think, Shraddha? 5, 4, 3, 2, 1. Snacking is good or bad? Evening time again, evening snack.
Healthy.
Bad.
Healthy
Healthy
snack is
snacking
good.
is good.
All the unhealthy snack.
Yeah,
This answer
healthy
I was
snacking.
awaiting. This answer I get in my classes every time. It's a very generic answer. Generic. Rubika, what do you think? Karina, snacking is good? Okay. Let us find out snacking
What?
is good or bad. Snacking is good or bad? We let us find out. To understand snacking is good or bad, we have to. There was a clinical trial done by a scientist called Guyton. Okay, he got Nobel Prize for it. What does it? What does it tell? Sanchita, can you read loudly? What is this? All aspects of. Can you read it?
All
What it is?
aspects of fat metabolism are greatly enhanced in the absence of insulin.
Very good. It
Gayton
means
and Hall textbook
fat burning
of
will
medical.
happen when there is no insulin. Insulin is low, fat burning will happen. Insulin is high, no fat burning. Yes. Now let us find out what happens when there is snacking is being done. Whenever you are doing snacking, even though you are taking a healthy snack or you are taking an unhealthy snack, remember, you will be making the insulin level to raise. It will raise the insulin level. Okay. Healthy snack you are taking or unhealthy snack you are taking an apple or biscuit, but in both cases, the insulin level will be raised. Understood? Yes. Now, what happens if you are taking in what is written here? Why not to take mid morning, mid lunch snacking? Because in the presence of even a tiny bit of insulin, all fat burning hormones are shut down. Means if you increase a little bit of insulin, it is a so strong hormone, fat burning hormones are stopping down. And when you are increasing the insulin level, also there is another hormone which is increased. That is called, what is the hunger hormone? Remember, what is the name of the hunger hormone? Sanchita, hunger hormone, the hormone that makes you hungry. Remember what?
Don't remember.
Hunger hormone's name? I hope it's a very simple name.
I
Sanchita,
think it
Shraddha,
starts with G.
G, you are correct. It starts with G. Ghrelin, ghrelin, ghrelin. Okay. Remember? Ghrelin. Okay. Sanchita, remember? So when you are taking snacks, the ghrelin increases. You will get more hungry. So if you are thinking I'm eating snack, earlier it was taught in MSc nutrition also, it is taught the old 30 years old syllabus. You take snacking, you will not get hungry. Morning breakfast, mid morning, mid snack, night snack. You are making the ghrelin to go high, you will get more hungry. People eat more food and also 5 more hormones are released. Number 1, insulin. Number 2, ghrelin. Number 3, secretin, which will make your stomach to become more hungry. Secretin is released, gastrin is released, GIP, gastro inhibitor peptide hormone, GIP, and cholecystokin, peptide hormone. 5 hormones are released, which will make the life very difficult. It will stop the fat burning, it will increase more hunger. Okay, so that's why nowadays only 3 meals, breakfast, lunch, and dinner. Now the question is, you will tell, sir, the client will tell, I am getting hungry after breakfast, then lunch. Definitely, if you take 4 idli, you will get hungry. If you take 2 chapati paratha, you will get hungry. You have to eat a food that will lower down the insulin level with healthy fats, micronutrients, macronutrients. Then what happens? Then You will not get hungry from breakfast to lunch to dinner, dinner to morning. Now, if you do snacking, you will look much older. The question is why? What is the science behind it? If you do snacking, your skin will not glow. You will look much older. The question is why? Any idea? What do you think, Sanjita? What is the connection of looking older with snacking? Any idea? No one? For that, you have to understand what is the name of what does it means. This autophagy. Anyone knows what is the meaning of autophagy? Autophagy. Autophagy.
Uh,
Did anyone know about it? Anyone has heard about it?
self
Yeah, tell us,
self-eating,
Doctor.
cells are self.
Self-eating or it is self-cleansing. It will be more correct.
Yes, okay.
Self-cleansing. Okay, what does it mean? It means that the body has there is a Japanese scientist who discovered this process. Our body has a unique way to self-cleanse. When it happens, when you are doing an interval, you are not eating for a time, for an interval period, the body starts, cleaning your old cells, cleaning your old, this, a lot of, whenever metabolism happens, there are a lot of byproducts are created, like amyloid peptides, lipids, okay, which are creating a lot of mess in the body. So if you are able to, do the, intermittent fasting, interval is there, the autophagy starts. These were discovered by Japanese scientist called Yoshinori. He got Nobel Prize in 2016. And what happens? Autophagy means your body starts cleansing and new cells are being, synthesized. The body starts reviving, rejuvenating. So that's why if you are doing a 3 meals per day or 2 meals per day, 3 meals per day is ideal. You will look much younger. Definitely, it will lower down insulin level, fat burning. You will be healthier. Okay, remember. Okay, 3 meals per day or 2 meals. Okay, now which most of the vitamin deficiencies are there. Which vitamin deficiencies are there in vegetarian population? Which vitamin is
B12.
less? B12 and
Vitamin
another
D.
vitamin is there, and vitamin D. But vitamin D deficiency can increase the weight. How, Dr. Rubika? Vitamin D deficiency can increase the weight. How? Icon, Harshita, Pannu, Gayatri, Karina, do you know how vitamin D deficiency can increase the weight? No one? Okay, for that you have to understand what is the meaning of stress hormone. What is the stress hormone in our body? No one
Cortisol.
knows? Cortisol. So what is happening when your vitamin D is less? It can increase the cortisol level, and cortisol can start doing, vitamin D deficiency can do gluconeogenesis. What is the meaning of gluconeogenesis? 3 words. Glucose, neo means new, genesis synthesizes means when there is a vitamin D deficiency is there, cortisol increases and it can increase our weight. Okay, cortisol can stop the fat burning hormone, number one. Number two, when vitamin D is less, cortisol is high, it can increase the process of gluconeogenesis. Means formation of glucose from carbohydrate, from other non-carbohydrate like protein, like muscle can break down and cause, it can convert into glucose. And this process is called gluconeogenesis. So it can increase the sugar level in the blood. Okay. So you will see a lot of people with low vitamin D are vegetarians, have a high tendency of having diabetes. When I have some client from vegetarian population, like either like Gujarat, Rajasthan, ask them who is diabetic in your family. Maximum time I get answer there is diabetic. So vitamin D deficiency can cause this high cortisol and also gluconeogenesis, and also can cause issues with diabetic issues. So when you create a vegetarian diet plan, you have to add vitamin D food also, vitamin B12 food also, otherwise the weight will not come down. Now another interesting question. Milk is good? Milk is the best? Yes or no? Dr.
No,
Rubika, milk is bad?
no, sir.
Oh, milk is good. Sanchita, milk is good or bad? Icon or Arshata? Milk is good or bad? What do you think? Somebody is writing. I don't know. I will read or not. Pannu Dilina is good. Icon is good. Oh my God. You are so good. Karina, milk is good or bad? Krishna,
It's good.
milk अच्छा है. Milk is good. Gayatri, milk is good. Sanchita, milk is good.
Milk
Yes,
is good.
but
Yes,
something you will tell. But, come on. But what? But what? Tell.
it's good
Okay.
for children, I think.
Not for
For
children.
grown-ups, there is a milk theory, like for animal, children of animal, they don't drink milk once they grow up. So I think
Yeah.
the nutrients that is provided by milk is not required for adults anymore. We can get it
Your
from other,
answer is Your answer is you might have read somewhere, or your answer is logical. You never see in animal world
yeah, we read it during our
elder
post-graduation.
animal elder animals are drinking milk. Do you saw the elephant? Elephant is the largest bone, okay, in the land. So elephant is
Yeah,
drinking milk. No, did you saw Sanchita elephant drinking milk?
no,
1 gallon, 2 gallon? No.
no,
So you can understand. A lot of people think elements are eating what? Elements are eating greens. So green vegetables are the best source of calcium. Number one.
yeah.
Number two, milk.
I think it was called milk controversy or something, sir.
Yeah. Milk controversy
I
was there. It
remember
was
20 years back.
yeah, it was done by a lot of governments in USA to take care of them
Yeah.
this milk market. The thing is, this what happens. Mother cow gives the milk for whom? For me, for Sanchita, for Dr. Rubika, for
For
Karina.
calf,
No, mother cow doesn't go no
for
knows
this
body
calf.
condition. Mother cow doesn't know the any one of us. Mother cow gives the milk for the baby cow. The baby cow when it's born it is 20 kg, and
Calf,
then when it
for the
is
calf.
after 1 year it is 200 kg. So milk contains growth hormones. So when you take
Okay.
milk, your body's hormonal imbalance will start happening. Number one. Number two, milk. If you take milk a lot, you will see a lot of issues. Inflammation happens in our body because milk contains inflammatory protein called casein. Okay, you will see a lot of people are taking milk after that acne starts. If you stop taking milk, acne stops because the growth hormone can increase the size of the glands, the skin sebaceous glands. So that's the reason, one of the things. Secondly, a lot of people think that okay, I am taking milk, I have got calcium. Yes or no? Karina, milk, there is a calcium. Yes, milk is white, calcium is white. Yes,
Yes,
the answer is the calcium is there, Sanchita, but
yes,
not for our body. We cannot
yes,
absorb any
right.
calcium from the milk. Why? To absorb the calcium, you need magnesium and vitamin D, which is not in the milk. So calcium is zero. Oppositely, when you drink milk, you will get osteoporosis. The calcium you will have, you will lose the calcium from your body. Why? The answer is milk is acidic, lactic acid. So when you drink milk, the body becomes acidic. Remember, cancer cells are grown in acidic environment. When you are taking milk, your body become acidic, and body needs a neutral pH. So it will take calcium ions from the bones to make the neutral pH, and you are getting draining calcium ion from the bone. After that, what is happening? Osteoporosis. Most of the these milk drinking nations are the osteoporotic in the world. Remember, so it is all myth that you drink milk, it is the best food. Also, milk contains lactose. What is lactose? It's a sugar. Okay, milk, 1 glass of milk will contain around 100 grams of lactose, and this lactose is absorbed in only children. Remember, Sanchita, you told something. Up to 6, 7 years, maximum 8 years of children can digest the milk. Otherwise, adult will take this milk and cause bloating, and also it will turn in the liver into fat. So it will increase your weight. Okay. Also, there are many clinical studies has been done that when you are drinking milk every day, you can get vitamin D deficiency. Why? Why? Do you know? No idea? Okay. So milk contains a protein casein. When your body is taking milk, your casein is very difficult to metabolize. It takes a lot of time by the liver. If you take everyday milk, the liver function has been disrupted. Other functions like creation of the vitamin D synthesizes like this. So you ultimately get vitamin D deficiencies. Okay, it is Yale University this research. And also milk casein is very sticky protein. It is very if the milk is falling in your table or whatever, it is very sticky. Same thing, it will enter your body, it will cause inflammation. It is very sticky, like a lot of people sinusitis or bronchitis or mucous glands are inflammatory. So milk is inflammatory. So we don't give milk in any kind of PCOD, remember. Thyroid, diabetes, we don't give it. Yes, milk products we can give, like paneer, because your lactic acid will be less, so it is more of protein. Definitely you can give in some diseases, but in milk consumption is not a good idea every day. Okay, I've seen nowadays a lot of cows' milks are added with synthetic oxytocin. Why? Because not all cows are pregnant or give birth, but there are cows who didn't give birth also giving milk by artificially injected oxytocin is a hormone for the milk, and RGBH. So all these hormones are coming to your body. I have seen a lot of girls are becoming PCOD in 11 years also. So this is a lifestyle changes we have to do. Also chicken is the best source of protein, yes or no? Sanchita, Rubika, what do you think? Chicken
Yes.
is the best source of protein. Yes, Bhavya
Yes.
Yes,
is writing.
Yes,
yes, it is lean
Everything is
protein.
right.
Yes.
Very good. Yes, I can. Okay, so Bhavya is also telling is chicken. Icon is also telling. Icon is Harshita. Yes, Shraddha is 45321. Krishna, what do you think? Chicken is good source of protein. Yes.
Yes. Yes.
Okay. Now let us find out the from where the chickens are coming nowadays. 99% chickens are coming from farmhouses. What is a farmhouses? Farmhouses where chickens are grown. They come very small in chicks, and they are given, and they are becoming big. They are becoming very big in 1 month. They should grow 5 months. How? They are injected hormones. They are given food
Hormone
with rich
injection.
in hormones, diet or silvestrol. Also RGBH, which are growth hormones, and it is going where? To their meat. So yeah, you are eating also lot of nice hormones which are very bad for us. Okay. So and pure chicken you will not find nowadays. So and these chickens when they are getting hormonal manipulation, they are growing very fast in 1 month because everybody wants to make money. And that is the reason. And also, and when the hormones are given, their immunity is coming down, and all are given antibiotics. You are getting good dose of antibiotics also. So antibiotics and hormones, what will happen to your body? Automatically they will hold water and make hormonal imbalance and weight gain. So if you take chicken every day, what will happen? Karina, Rubika, there is a high chance of getting weight gain and inflammation in the
Wait.
body. Because I'm not telling stop taking chicken. You can eat chicken for your entertainment, but not every day. Once in a week, you take 2 times in a week. So that's why it is what you know, you have to analyze it. So reality is different. Sanjit understood? Yes. Why chickens are not very much only source of protein. You have to add other source of protein also. Plant protein you have to add. Not only animal protein, plant protein can be added because you are getting a lot of hormones. You will see a lot of people are getting so many diseases nowadays. Thyroid, PCOD, 11 years girl,
Sir,
10 years girl. Okay. So farm since
sir, in
99% chickens are all farms and there you are getting hormones and antibiotics. Okay. Sanchita, clear now? Yes? Okay. Now, definitely when you take proteins, we will have separate lecture for protein. Proteins are not absorbed fully. Okay, so there are many techniques where you will be able to, learn how to improve the this improve the this when you will be able to improve the absorption of protein. Okay. So definitely the knowledge of how to improve the this absorption of protein, how to improve the food intake and absorption, everything is dependent. Otherwise, if the insulin resistance is there, you will not be able to get good results. Okay. Understood, yes. So, first of all, definitely it is, only by this learning, this theory is not enough. So you learn what to, this one, what to, how to get the proper balanced diet, because eating less food is not, it's not enough, because if you are taking calorie deficit diet, you are reducing the vitamin, minerals, protein also in calories. So what happens generally? It is causing deficiency. Okay, so ideally you will learn how to create a hormonal balanced diet. Means all nutrients, vitamin, minerals, protein has to be balanced. Okay, then your fat burning hormones will be activated. Ideally, you don't have to eat less food. You have to activate. You have to have a balanced food to and lower down the insulin level and activate a fat burning hormone. Three things you have to do: balance food, lower down the insulin level, and activate the fat burning hormone. Then you will get the best results. Then you will have the hormone imbalance. How to balance the hormones? You can see here. All this kind of hormonal imbalance can be treated by, or like, oranges, mood swings, fibroids, everything. And all these are symptoms of the hormonal imbalance, like weight gain, tiredness, insomnia, acne, mood swings, night sweats, headaches, food craving. Okay. And definitely how to create the hormonal balance, that you will learn how to create the anti-inflammatory diet, how to create the an autoimmune diet, everything you will learn. FODMAP diet also for the gut health you will learn. Insulin resistance diet for the diabetes reversal diet, and you will learn with all vitamins, minerals, protein, fatty acid, fiber, everything you will learn. Definitely it is important to have the practical knowledge. So after each module, let's say 2 months, after 2 months, after, you will get some 2 3 months, you will get some clients. How you will get the clients? There are two ways: either you get from yourself, or you can get from my side, because I have a marketing team, 20 people are working. So we do a lot of campaigns in Instagram, Facebook, and we pay money for the campaigns. And when you get a client, you have to create a diet plan. But this group I'm taking, so I'll be giving you the template for a diet plan. You create it, okay, weight loss or weight gain, and send to me, and I will check if everything is fine, or some mistakes are there. It's fine. Everybody learns from a mistake. Then you learn, and after that you can give to the client. But giving the client a diet plan is not enough. You have to take a follow-up also. Follow-up means what? Every day you have to see the weight is coming down or not. Every monthly, if you don't do follow-up, daily don't do follow-up, nothing is going to happen. The client will do mistakes and blame to you. They will tell your diet plan is not correct. So every day the client has to send a photo of the weight machine, like how many grams, 100 gram, 200 gram is reduced. After that, let's say, they have to send a photo of the food. Sometimes it is, mistakes are there. One of my clients was telling, I am taking the diet as per as you told, but no weight loss. What you have eaten? She told me I have eaten 9 10 p.m. To 10 p.m. no weight loss will happen. And also I have eaten, she told I have eaten sweet corn. Sweet corn is a carbohydrate. She thought is a vegetable. And also sometimes the weight is stuck. Then you have to ask question: what time you have eaten? What you have eaten? Maybe the client has eaten very late in a party, in a ice cream or something, or lot of sweets, or constipation is there, or sometimes there is, let's say, periods are there, weight may get stuck. All these things you learn, by interacting. And for 1 month, you have to create a WhatsApp group where you are there, I am there, and a client is there, so I can give you the suggestion. So in this way, practical things you will learn. And definitely, this after 1 month you have to submit the report. It becomes a practical exam. Okay, exams are case studies, means you don't have to write 10 pages. You have to give a diet plan. And how you are getting the clients? Look, nowadays there are a lot of big cities. We are doing campaigns. Campaigns means if somebody is writing, I have a PCOD, I have a diabetes, I have a diet plan, they will see our ads. For that, Google, Instagram, Facebook will charge money from us, and they click on our ad and register our call center, connects them. Also, if you are talking in the phone is listening to everything. Like somebody is talking, I have a diabetes, I need a help. The phone will give a ad of diabetes. Like you want to buy a bag, you will tell, I want to buy a bag. Then you will see the ad in the Facebook. So this in this way the apps are listening. So in this way they will see our ads and they click on it. After that, these lines are given to our team members or my students. Okay, because there are three categories of clients out there. First category clients, they are very rich clients. Let's say they are VIP clients. They have been with the dietitians for many times. So they are very demanding. So this kind of client we charge more money, and we do a DNA based diet plan. What is DNA based diet plan? It is depending on the we check the DNA of the person and create a diet plan which is completely precise. What kind of food is adaptable, which kind of food will be absorbed, which kind of protein will be better, which kind of micronutrients, which kind of food is not good. And at the same time, we also know which kind of disease the person can have. So in this way, these diet plans are very expensive. It can cost 1 lakh also, because not everybody can pay. 50,000 is the DNA cost and 50,000 is the diet plan. So this kind of client you will not get immediately, you will get after, let's say, 6 months of experience. There are second category of clients which are corporate clients, middle class clients. We are charging 10, 20,000. Also, there are clients who are poor. Definitely, we charge very less because they cannot pay. And earlier we were giving free diet plans, but when you give a free diet plan, people are not very serious. They will tell that tomorrow we'll start, day after tomorrow they will never start. So we stopped giving free diet plans. So we charge some money, and let's say 4, 5,000, small amount of money, which you can also keep it, because we don't take from you. For the practicals, you can get, let's say we can give you 3, 4 clients in a week, you can earn around 15,000 in a month. Let's say 40, 50,000 you can earn. Definitely, after 6 months, you will get the certification. If you are an intern, you will get the certification also, that you have done how many hours of classes, which subject you have learned, and what kind of expertise you have, what kind of practical knowledge you have. After that, you can work alone, you can work in hospital, or you can join my team. It's up to you. Then definitely you can get the clients of a high value client if you are in my team. So generally average 20,000 we charge, and we work in 50%, because we have to give salary to our people. We have to also give money to Instagram, Facebook, Google ads. They also charge money. Okay, so in this way, 10 clients you are getting, you can earn 1 lakh, 1 or 2 lakh, 20, but 20% you are getting. So all these things we have to discuss one-on-one basis, because everybody has different needs. Somebody is from IT background, you want to go to the, you want to start with a basic course. Somebody is a doctor, dietitian, you have to start with an advanced clinical nutrition course. Somebody wants to do internship. So we have to talk differently, talk individually. So what I will suggest, we'll just talk after this meeting. Okay, you can talk today or tomorrow. It all depends on you. If you are available now, you can talk, so that I can give you the full idea what kind of courses, what kind of training programs, what kind of internship issues are there, and how you, if you want to get the client, how to get the client. If you want to do the PG, PhD, whatever, you can discuss with me. Okay. And I hope today the webinar was knowledgeable for you. Everyone learned something new. Okay, so I hope a lot of things today, what we learned about acromancy, eosinophilia, GLP-1, GLP-2, fat burning hormone, diabetes reversal, PCOD reversal. These are the latest in nutrition and dietetics. And even if you know, you'll be able to help so many people, and you'll be able to also earn also. Why not? It can be your extra income, additional income also. Okay. So thank you for everyone, and definitely I'll be very happy to connect on WhatsApp call, so that at least I can give you a guideline how we can because next class will be on 27th, will be the next class. And before the next class, I will give you some study material. Okay, the study materials are sent through the learning center. Okay, so I will details, I will explain everything, and so that you get the study material and we can come prepared. Okay, so definitely I'll be looking forward for the next class on the next week. And Krishna, I have sent you the recording. You can watch the recording a little bit. Okay, what part you have missed, or you can talk with me today or tomorrow. Okay. Okay, then I'm very happy that everyone has joined, and I hope you learned something new thing. Okay, so everyone, Karina or Krishna, Rubika, I think Sanchita, you told you want to talk with me. Ponu, Dilna, Bhavya, Shraddha, no, Shraddha, no, icon is Harshita. Just talk with me. We'll discuss how you can go ahead with the next step. Okay, thank you and goodbye to everyone. Good night. Okay, thank you very much. Goodbye. Thank you.